I'm Dr. Mtetwa, Chief Director, Department Social Development and Disability Affairs. These are two main departments in the ministry, which is the Department of Social Development, formerly the Department of Social Welfare, with a number of programs, that are meant to ameliorate the plight, of people, living in poverty. And the programs that we have, among others, are as follows. One, we have, the social services, programs, that is your social protection, including a number of social safety nets, where we have the basic education assistance module, BIM, and we have a harmonized social cash transfer, program, meant to assist the poor, with just money to meet their daily needs. We also have, the food deficit mitigation. We also, in the same manner, have, are in charge of, the registration, and regulation of private voluntary organizations, in that department. We also have a very huge chunk, of responsibilities and mandates that comes in the form of, child welfare, child protection, issues, under, such pieces of legislation, as the Children's Protection and Adoption Act, Child Abduction Act, Guardianship of Minors Act, Maintenance Act, among others. Of course, not forgetting the Constitution of Zimbabwe, as the supreme law of the land, which statutory obligations require that we safeguard, we protect and promote, the interests and welfare, of children. That is done through probation work, and as well as helping children, go to school through the basic education assistance module, and our national plan of action, for orphan and other vulnerable children, which is now going toward its fourth, phase. Last but not least, we have an elaborate grassroots, system of child care that comes in the form of what has come to be known as the National Case Management, system, which system provides us with the information, and makes it very possible for us to, cascade our services down, to the grassroots through, our national, case care workers. In the disability portfolio, the government in 2018, came up with a fully fledged department headed by a director for disability affairs. Chief among the functions of that department is simply to make sure that the rights, and aspirations of persons with disabilities is enshrined in a number of national and international, conventions, and the statutes, is realized. I think the nation might want to know that in June this year, His Excellency the President of the Republic of Zimbabwe, Comrade Idi Mnangagwa, launched the National Disability Policy, which was in the disability fraternity a key milestone, in as far as the realization and pursuit of disability, rights is concerned. So the department does a lot of rehabilitation, rehabilitating persons with disabilities through its, vocational training centers, through its rehabilitation centers, such as the Rural National Rehabilitation Center, Beatrice, and among others. And what normally happens there is both the issue of orthopedic, rehabilitation, as well as skills training or vocational training. The same department also is into, issues of livelihoods, wherein they have a disability resolving fund. That person's disabilities rely on in each time they want to pursue, income generating projects in order that they are able to fend, for themselves. In the same manner, the department is also responsible for, the state service benefit, for those people that are injured on duty, particularly civil servants injured on duty. It is that department that handles, that portfolio. Last but not least, we, as a ministry, both departments, they've got quite a number of key stakeholders, namely the UN family, our private volunteer organizations, line government ministries, as well as the corporate world. And we endeavor to pursue, and promote the welfare of everybody, in the country through evidence-based, social policy, programming, in the country. And we, in pursuit of the Vision 2030, we remain open to new ideas and ideas that, result in, the improvement of the welfare, of our population. Thank you.
My name is Dr. Christine Peta. I'm the Director of Disability Affairs in the Ministry of Public Service, Labour and Social Welfare. One of our key achievements this year, 2021, is the launch of the National Disability Policy by His Excellency, the President of the Republic of Zimbabwe, on 9 June 2021. The National Disability Policy provides a roadmap for disability inclusion in the country by, number one, directing the mainstreaming of disability across all policies, laws, and programs, and number two, the establishment of disability-targeted projects in all the 10 provinces of Zimbabwe and in both rural and urban areas. The National Disability Policy 2021 demonstrates the Second Republic's commitment towards fulfilling, promoting, protecting, and respecting the rights of persons with disabilities in the country. Why does disability matter? Disability matters because anyone can acquire disability at any time of their lives. Persons with disabilities are found in all communities and societies of the world. The National Disability Policy of Zimbabwe 2021 therefore consists of different subjects that seek to address the needs and concerns of persons with all kinds of disabilities. The key highlights of the National Disability Policy include each private or public sector should consist of persons with disabilities. A minimum of 15% of student teachers per enrollment should consist of persons with disabilities. A minimum of 15% of scholarships on all scholarship programs should consist of persons with disabilities. A minimum of 15% of healthcare students should consist of persons with disabilities. A minimum of 15% of residential stands or houses on all public housing programs should be awarded to persons with disabilities. But now that we have the National Disability Policy 2021, what should we do next? The Department of Disability Affairs in the Ministry of Public Service, Labour and Social Welfare is seeking collaboration with a diverse range of stakeholders so that we can together move the National Disability Policy 2021 from paper to the real world to make a positive difference in the lives of persons with disabilities in both rural and urban areas.
Welcome to the Department of Social Development. My name is Mtetwa, Acting Director, Social Development. Right, the Department of Social Development has got two major sections, which are Child Protection Services and Family and Social Protection. Under Family and Social Protection, we do have quite a number of social protection programs that are namely Food Deficit Mitigation Program, of which the majority of people refer to as drought relief. This is a program that really addresses food insecurity to make sure that households that are food insecure have got a transfer in the form of either cash or cereal, to make sure that at least no one will starve. We also have the Harmonized social cash transfer, which caters for labor-constrained and food-poor households. And this program, we are now using cash transfer, using a mobile cash transfer. We no longer use the cash in transit, or which we initially used. So now beneficiaries receive their money through transfer, either using mobile money transfer, such as EcoCash or Net or Wallet. So each beneficiary under the Harmonized Social Cash Transfer, each household is paid according to the size of the household. So really up to a maximum of 2,500 Zimbabwean dollars. Then we come to the next one, is the PA, or public assistance. The public assistance, this is another program that really government transfers cash to indigent families or the poor families. And these are mainly after a means test. They undergo a means test, and after that, then you will be paying them a flat fee of 1,500 per household. And then we do have another program, which is pauper burial. Pauper burial is a social protection program that is offered to indigent families or to pauper families, whereby they are not able to bury their loved ones because they will be lacking the resources. Therefore, they approach government to assist them to bury their relatives. Or if one is a destitute and there is no traceable relatives, then the government will offer what is pauper burial. And our pauper burial is, we outsource pauper burial, which means we also use a private funeral parlors, whom we pay upon having delivered the service. Then the other program is the health assistance. With the health assistance, we do have what we call assisted medical treatment orders, which we issue to our clients so that at least they can access health services at referral hospitals, that is the district, provincial, and central hospitals. We also, under the health assistance, we also pay for specialized medical assistance to deserving clients, even if the service, if it is critical and the service is even cannot be accessed, it is not available at the government hospitals. That service we can even pay to make sure that the beneficiary gets services at the private institutions. But our first port of call are government institutions. Then in the other program under the Family and Social Protection is the Sustainable Livelihood program. This is a program whereby we are building resilience for communities to make sure that at least they will choose the community selected program or projects which they feel they would improve their livelihoods. And as the department, we supported them with financial assistance, but we also expect communities to contribute 30% towards the projects. And mainly this 30% is through labor that they contribute and other local materials to make sure that the projects are successful. Then we also have the Refugee Protection as another program. All refugees and asylum seekers who come to Zimbabwe, they also need protection. It means they need shelter, they need education, they need clothes, they need security. So what we do as the ministry is we provide them with the protection to make sure that they have all their basic needs, just make sure that as human beings they also live a decent life. Currently Zimbabwe has got an encampment policy, and therefore most of the refugees and asylum seekers in Zimbabwe are based at the Tongogara refugee camp, which is in Chipinge. Then we also have another program, which is the private voluntary organization, that is the registration and the monitoring of private voluntary organizations. Most people refer them as to NGOs, but so these are registered by the ministry, and we also supervise them, monitors that they are doing what they registered that they were going to do. In the event that we also do register errant organizations that will transgress from what they were registered to do. So therefore, so our purpose is to make sure that we register, and we monitor them, and then under the child protection services, we offer a range of social protection services specifically designed for children. We do have the National Case Management, which is a national case management system, which is a system which ensures that a child receives minimum basic services that we expect to make sure that it is once we provide a service to a child, there is follow-up until we make sure that the child has been weaned or has been discharged or has been weaned from the services that that child receives. So there is a closure to the case. So we really want to make sure that we follow up on the child, and to make sure that the child has been linked with other service providers, and the child has received at least a standard package of services. Then we also offer the basic educational assistance under the basic education assistance module, which is the BEAM. This is a program whereby we provide tuition and examination fees for children from poor households who cannot afford to pay for the education of their children. For example, in 2021, we are targeting to assist 1.5 million, that is 1,500,000 children whom we are going to, and I think the figure will be more than that, because we also pay for the examination fees. The other parents might only manage to pay tuition fees, but they fail to pay for the examination fees. So as a ministry, we want to make sure that no child is left behind, and we also pay for the examination fees. Therefore, the ministry assists poor families or families that have been affected either by COVID or other natural calamities that inhibits their coping capacities, so that government will come in and make sure that children have got right to education. We also have the program under the Drug and Alcohol Abuse Prevention, which we also work with other stakeholders, the Ministry of Health and the civil society organization, to make sure that we prevent drug and alcohol abuse among children and young persons. And this is another program that we offer, services that we offer as a ministry. We also provide for the registration and monitoring of children's homes, so that at least those children who cannot live within families, then they can be placed in institutions. Though we regard that institutionalization should be the last resort when we provide these services. And lastly, but not least, forgotten that I'm also getting old, we also care for the elderly, which is, so we really care for the elderly. We make sure that the elderly, they enjoy their rights. They are also protected. We provide accommodation. We provide per capita and institutional grants for those older persons that lives in institutions, and we also provide meals, that is food for them, and also because of their advanced age, they need specialized medical treatment, which the ministry would also provide. Thank you very much. In brief, that's what the Department of Social Development provides. Thank you.